A new group is pumping thousands of dollars into TV ads this summer. It hopes Texas Senators Cruz and Cornyn take a side on a controversial medical fight about to go down in D.C. when lawmakers return in September.
They want you to side with healthcare providers, doctors, and hospitals over insurance companies when it comes to surprise medical billing. Here's an example. Say you go to the hospital for a routine checkup. The visit would typically be covered in most insurance plans. But what if your doctor calls in a specialist to look at a specific problem? In this case, you could be on the hook for thousands of dollars that you weren't expecting to pay because of that out-of-network care. KXAN's political reporter Phil Prazen is here looking at that dark money organization behind those ads. Phil.
When senators return to work in September, they'll work on a bipartisan bill trying to take the financial load off of the patient when insurance and doctors can't work it out. That includes setting a regional benchmark for how much out-of-network providers can charge you at the hospital. That's what they mean when this ad uses the term government rate setting. The goal is to stop wild fluctuations of what patients get charged for the same service. The group Doctor-Patient Unity is running these ads to get you to side with the doctors and oppose that idea. You've likely seen this on KXAN. An emergency crew rushes a patient to a hospital only to find no doctors are there. This is the fear for many doctor and hospital groups. If they eat the cost for surprise medical bills, they couldn't bear it and they'll close. The group Doctor-Patient Unity only lists a P.O. box in Alabama as a contact for their treasurer, Jana Rutland. They don't have to tell the public who pays for the ad and haven't since a Supreme Court decision in the 1970s.
This is baked into the First Amendment of the Constitution, right? The right to petition government. That's what they're doing, right? They're saying, hey, we think you should do X or not X.
Professor Brian Roberts will teach 2 classes on money and politics next semester at UT. He says these issue ads are not new at all. While these ads mention senators, they don't campaign for or against that person, so they don't have to tell the Federal Election Commission where the money comes from. You'll likely see more of these because there are billions of dollars at stake across the country.
One would be surprised if there weren't people intervening and expressing their views about this sort of thing.
And I spoke with Jamie Dudensing, the CEO of Texas Association of Health Plans, by phone. She supports the benchmark idea because it will adjust to the market, basically following the average rates doctors charge in a certain region. She says that's fair, and if insurers have to shoulder the extra cost rather than the providers, it's likely your premiums will increase. U.S. lawmakers return to the Capitol in September.